Leslie?
Thanks. I think I'll turn my phone off now.
Leslie, hi.
Hi, how are you?
Good to see you.
Good to see you.
Okay, how you been?
Everything's great.
So hyperhidrosis is a condition that creates excessive sweating in the body. Now it could be any part of the body, but often involves the armpits, the palms, as well as the soles of the feet. But even people that are sweating on their brow or on their forehead, or anyone that has excessive amounts of sweating, even under relaxed, cool conditions, can often still be moist and sweating.
Well, I'm way overdue.
You're overdue.
The moisture's coming back and it's really time to do it again.
When did it start coming back? A few months ago?
A few months ago,
Okay.
yes.
So it was holding strong for a while, and then
When you do it, right after you do it, about a day later, it really kicks in and it takes care of everything.
the condition often becomes socially embarrassing and affects their daily function.
I've been dealing with hyperhidrosis or sweating since I was a teenager. And it's something that I couldn't figure out how to fix it. I tried every over-the-counter product I could find. And finally, as an adult, I went to Dr. Spitz and I asked if there was anything that had come out that could help with this problem.
We now have FDA approval for BOTOX injections into the armpits. There are other ways of treating hyperhidrosis. They include topical, prescription, and over-the-counter medications, oral medications, and a procedure called iontophoresis, which is a procedure that is home-based but can be quite cumbersome and take a long time to do every other night at home for 45 minutes. We were recommending surgery for people that failed topical prescriptions. The surgery involves cutting a nerve ending that causes hyperhidrosis, and it's a fairly involved procedure going to the hospital. It can cost up to $15,000 to $20,000. The most major complication with that procedure is what we call compensatory sweating. Depending on the study that you read, 80 to 90% of patients sometimes sweat all over their body except for their armpits. Some studies quote 10%, but you can find other studies that go even up to 80% of patients. So we come to BOTOX, and BOTOX has been a life changer for me as a physician and for my patients who literally want to hug me when I am done doing this. All right. Oh, I have patients that change their shirts 2-3 times a day.
No, but I wear sweaters in the summer just to hide it, and that's not comfortable.
Mm-hmm.
It definitely has been a life-changing experience to be able to find something that I could do only about twice a year. I saved clothing from being ruined. It was always an embarrassment, and it was something that I had in my family. My father suffered from this, my brothers suffered from this, and my kids, my nephews. So it's something that I've dealt with, I've seen, and after these injections and finding out that this did help, it really has been life-altering.
Yep, hang in there, you're doing great. In 2 or 3 days, this will be gone. You won't have any moisture there.
I have a position that puts me in front of the public a lot. Even before that, though, as a teenager, I suffered from hyperhidrosis. And so for my whole life, practically my whole life, I was searching for something.
There's a broad range of ages that I treat, and I treat both men and women. I have no side effects ever with any of my patients. There is a little sting when the injections go in, but we now are offering people EMLA cream, which is a topical cream that numbs the area before you come in, so you don't feel anything when I'm doing the procedure.
He keeps me very calm when he's going to do the procedure. Nobody likes to have injections. Nobody likes to see a needle coming at them. But because of his personality, he does keep me very calm.
And we'll actually get your mind off of things by letting you use an iPod. You'll still be moist probably for another day or two, and then that will be gone. Expect 6 to 8 months like you normally do without any sweat.
It's really a hidden problem.
I think a lot of people don't realize there's something that can be offered to them to help them. They're sort of closet sweaters. Michelle, who's you have the next patient ready to
Yes,
go?
they're in.
This is not a cosmetic procedure. This is as simple as just paying your copay. Every insurance company, just about every one of them, covers this procedure. It is recognized as a medical condition. Rexy, hi. How are you? Good to see you.
Me too.
How you doing? All right?
Good.
Yeah?
Yeah.
Is it-
Much better.
Yes?
Yes.
Even if you're working out
I can
or...
wear sleeveless shirts now, no problem. I've had this condition for almost ever since I can remember, since I was young. Just severe sweating. Sometimes it's embarrassing.
This is a life-changing experience. People no longer have to think about their dripping on the sides of their body. They no longer have to think about the color of their blouse or shirt that they wear because the darker colors will bring out the stain more.
You know, I Googled it first and I found out, you know, there was other remedies like antiperspirant, like a prescription strength that didn't work. And then I saw the advertisement for the BOTOX and then it was covered through insurance. So I gave it a try. At first I was a little hesitant because, you know, a needle. But it was painless. I got a cream, a numbing cream to put on, and I didn't feel a thing. I had my iPod with me. I was listening to music, and it was quick. So, and I don't have to come back in another 6 months.
Your insurance company should continue to pay for this.
Yes.
And then we'll see you then.
Okay.
Okay?
Thank
All right,
you.
great. Good seeing you again.
You too.
Excessive sweating is a medical condition with millions of sufferers across the country who are not getting the appropriate treatment. And we have to do our job to get the word out and reach all these patients so that they can come in and live a better life.